This is our 10th session. I welcome you very much to this new year, and I hope everybody has enjoyed the holidays, depending on Corona, but with a lot of optimism and, of course, a very good feeling that this year we shall embrace each other and we shall kiss each other in a new world, because I think this world has given us a lot of insight to our own thinking and to our own behavior through the nature and the nature things that have happened. And of course, I am very happy to be again with you online with these Collegium Medicorum Theatri sessions, and I hope you enjoy. And please do not forget, we have to be together and to discuss all these very interesting things about artistic voice. Artistic voice has been sleeping a little bit these 2 years of pandemic, but I am sure this 2022 is coming with a lot of anxiety and a lot of enthusiasm, and is going to give us a lot of joy. So I invite you all to our next session. Don't forget, we have already scheduled our sessions bi-monthly as you wish. And so we shall begin with this 10th session. I welcome you very, very much to everybody, to Dick, hi Dick, to Andrea Ricci Maccarini, Carissimo Andrea, Tom, Sarah and Tom Harris from England. Dear Sarah and Tom, I miss you dearly. Lieber Professor Jürgen Wendler from Berlin, that he's now with us. Eleonora Bruni, ciao, carissima. Ana Gloria Ortega de Buenos Aires. Hola, querida. Alan Burma from Tallinn, Estonian. Hello. Marco Fantini, ciao, carissimo Marco. Ciao. Queridísimo Alfonso Borragan, es fantástico tenerte. Jana Montecalvo, ciao, cara Jana, we enjoy your video very soon. And Erika Biavati, ciao, querida cara Erika, we also enjoy your video. Hi, Jeremy from the States, nice to see you. And Daniela Steve, liebe Daniela von Österreich, aus Wien. Das ist Session, dass Sie bei uns sind. Mein lieber Professor Wolfram Seidner, das ist Session, dass Sie bei uns ist. Adi Primo Fever, our dear member, secretary membership. Hi, dear Adi from Tel Aviv, Israel, our next organizer, hope so. And our dear John Rubin from London, England. Dear John, great to have you all. And we shall begin with this wonderful session. I hope you enjoy that. And Soledad Sachieri, I saw your name, but I don't see your video, dear. Well, hello, Soledad. Hola, Soledad de Buenos Aires, Argentina. So we shall begin our 10th session. And of course, I know this is many activities going around the world, but anyway, it is a pleasure to talk about artistic voice in this very special group, Collegium Medicorum Theatri, with many experts around the world. So we have Germany, we have the United States, Spain, Argentina, Italy, and Erki Bianco from Paris. He apologized, also Lisa Popey, because they have already, Bruno Colombo from France is also apologizing not to be with us. Please do remember, we shall have also this session in our YouTube channel. So we shall begin. And thank you very much and welcome again from Mexico City. This is our first presenter, as you know, our dear Dick. Hi, Dick. Carlitos Richard Ricardo Satsney from Houston, United States. He studied at Baylor College of Medicine in Houston, He made general surgery residence and otolaryngology head and neck surgery residence in Baylor, and he is founding director of the Texas Voice Center in Houston. He has been also professor many years of otolaryngology at the Weill Cornell Medical College at the University of Texas and Health Science Center, and also at the AM College of Medicine at Baylor College of Medicine in Houston.
That's plenty.
Well,
I mean, they don't care about all that stuff.
also, he has been adjunct professor of performing arts medicine at the Rice University. He's a wonderful and very, very experienced otolaryngologist and physician, and he is working with the Houston Grand Opera, chairman of the Center for Performing Arts Medicine at the Methodist Hospital in Houston. And he has been elected as the best and nominated as the best doctors in America in the Texas Super Doctors, Bravo, Bravo, and also top physician and best doctors in Texas. I have to say, Dick, that it was not so easy to make a short curriculum, but anyway, we welcome you and we are very happy you shall talk about this very interesting theme that you are going to motivate all our international group in order to have these performing arts medicine centers.
Thanks, Eugenia. I've given a talk on reflux so many times I've got reflux. But this one is going to be on something I think is important to everybody that's listening today in every major city in the world. The Houston Methodist Hospital started the Center for Performing Arts Medicine 25 years ago. And I'm going to talk a little bit about problems of performing artists and why it's so important to have a center like this in every major city in the country. We all know that there's a doctor on I was one of the doctors as an airway doctor for the Houston Texans. And they never needed me, so I just hung out with the cheerleaders. Because we never had an airway problem. But anyway, in case we did, I was there. They've got doctors on the sideline of most sporting events. And my idea was to have doctors on the sidelines of arts events as well, either figuratively or literally. And so that's why I think that every major city in the world ought to have a Center for Performing Arts Medicine. Started here in Houston, I was a Houston Grand Opera doctor for 10 years. And the other arts thought that if you're the opera doctor, you can take care of the ballet or the symphony or the alley theater for performing arts. And I got a call from the Houston Symphony. They had a very famous concert pianist who had a thrombosed hemorrhoid and couldn't sit down. And they asked me if I would take care of him. And I said, well, I'm ENT and I don't go that low, but I'll find somebody that can. But that sparked the idea of having a consortium of physicians in different specialties to take care of every part of performing arts. And that's what we did with opera, ballet, symphony, and alley theater. And we're the primary healthcare provider for these, but we also take care of all the other arts, the colleges, the universities that have arts programs. So I think it's really important to have a center that has physicians that are all dedicated to care of performing artists. Many physicians have actually been performing artists or play musical instruments. So that's our center here in Houston. Methodist Hospital started this 25 years ago, God bless them. And we focus on education, research, and patient access. So all the doctors, we have 105 doctors now in different specialties. And if we call and say we've got a ballerina whose ankle is swollen, they'll get her in within 24 hours. Same with a pianist that has a carpal tunnel or a violinist. So I think it's really important to have expedited patient access, and particularly with physicians that understand the problems of performing arts and particularly their area of expertise. And it's fun to get to be around performing artists. That's Bryn Terfel, who greatest baritone in the world. He can hit a golf ball 330 yards. Doesn't always go straight, but he can hit it a long way. and Celine Dion. It's just great fun to get to know these people and realize they're human beings. And like any human being, when you hit 50 years old, there's certain things you need to have done. And so we need to recommend a colonoscopy, appropriate diet, all the things that you would recommend for people, mammograms for females starting at a certain age, whether it's 40 or 50. Janet Horvath in Minneapolis plays a cello with the Minneapolis Symphony, and she wrote this book and talks about injury prevention as a guide for musicians, particularly with string musicians. Hearing loss, we all know about that. Wind players, if I got a cold or got a mild case of COVID, it wouldn't be that big a deal to me. It would be a big deal if you're a wind player or a vocalist. French horn players get cardiac effects, and people haven't gone into that in great depth to see that. But that's an example of the fact that performing artists have problems in lots of different areas. The increased intraocular pressure when you blow high pressure instruments like a horn or a trumpet or an oboe can raise the pressure in the eye dramatically, and they can have actually glaucoma symptoms, even though if you see them at normal rest, they have normal pressure. But when they blow their instrument, pressure goes way up and they can get glaucoma changes. Repetitive motion injuries are very common in performing artists, and that's why it's so important to have orthopedists, whether it's a hand orthopedist, a foot and ankle orthopedist, low back orthopedist, they all need to be involved. Dentofacial abnormalities, biomechanical problems, TMJ, that's violin and viola players commonly have TMJ problems. They also have a hearing loss in the left ear. And that's because a violin puts out 110 dB. And our wonderful OSHA group in the United States says that you can't be exposed to 110 dB sound more than 30 minutes a day. Have you ever met a violinist that practiced less than 30 minutes a day? I don't think it exists. So that's why that's a problem, and we need to address that. It's important to know about the oscillators. Obviously, the oscillator I'm concerned with are the vocal folds. But if you're a wind musician and you're playing a horn, this is Bill Vermeulen. He's the principal horn for the Houston Symphony, probably the finest horn player in the world. And I got the idea, well, dystonia of the lips is not too uncommon. And if you see somebody with dystonia of the lips, how do you document it? And so we looked at the lips like you'd look at the vocal fold.
Low frequency. Again. Slide right up.
And the thing about that is that we found that if they have a focal dystonia that involves the embouchure, then sometimes you can put Botox in the glabellar area and the embouchure will relax. So you don't necessarily have to put the Botox in the embouchure itself. And I work with a facial plastic surgeon in Houston that we've done several trumpet players that had a focal dystonia and gotten some success with Botox, not in the lips, but in the glabellar area, which is the safest place to put Botox. The pressure in the, why they blow out the larynx and you get these laryngoceles, and I put probes in the nose to check and see what the pressure was in the back of the throat when you're blowing a trumpet, an oboe, a horn, a tuba, a trombone. And we found that the pressures are very high in the back of the throat. And I wrote a paper that people that are kids that are in school that haven't gone through puberty probably shouldn't play high pressure instruments. They ought to stick to things like baritones, tubas, and saxophone and clarinet, and not do horn or trumpet or oboe until they pass puberty. because we've seen some gigantic laryngoceles, and particularly in oboe players. 61% of oboe players have laryngoceles, and their neck will go from size 20 when they're blowing the oboe down to 17 or 15 when they're not blowing it. And this guy's done a lot of work on breakthrough in human performance with an application to musicians and dancers in Dallas. A good guy. Let's see. And we checked the tongue positioning and clarinet. This is a professor of clarinet in Houston. And I'm not sure where that blue line came from, but just kind of ignore that. Nutrition, Dan Benardot is a well-known nutritionist. He's an Olympic nutritionist for the American Olympics. And we found that performing artists burn a lot of fuel. And matter of fact, the violinist can burn up to 750 calories per hour. And their heart rate can go up to 160, 170 while they're sawing on the violin. So we need to think about that and maybe replace water with Gatorade or some nutritious drink that has all the minerals in it and a little sugar in it so they don't get hypoglycemic. One advantage of being the opera doctor is many times opera singers, that was Cecilia Bartoli, and many times they stay with you. And so I get little private concerts at home. And we can all say this, it doesn't matter what our specialty is, but we've all, to see further, we stand on the shoulders of giants. And this is a giant on whose shoulders laryngologists stand, Manuel Garcia. And Friedrich Brodnitz said this about the voice. A voice is incredibly important. And obviously the only reason that I had an income for 35 years. These are vocal folds opened and closed, breathing on the right, talking on the left. And here's some examples of laryngeal pathology. That's a dry larynx. And if you show an opera singer this, they'll start drinking water. And when you fly from Milano to Houston, airplanes will dehydrate you. And I wanted to do a study and would weigh people in Milano, and then somebody would weigh them when they got off the plane in Houston. I wanted to do the Italy part of that test, but I got voted out of that. And to see how much weight they lost, and because it would be insensible loss on an airplane, which would be a tremendous amount. So they need to stay hydrated. Polyps, gap in the larynx, and we've got new treatment for that, whether it's installing Gore-Tex or fat. And here's a reason to cancel an opera and tell them not to say anything for 2 weeks. And if it's bad enough, you have to go in and drain the hemorrhage. Gore-Tex thyroplasty, I was doing a thyroplasty with Celastic implants. And I told one of the nurses in the operating room, I said, this is really annoying because I can cut my fingers when I'm trying to carve this hard block of Celastic. And they said, well, why don't you put Gore-Tex in there? And I said, you mean the stuff they make hunting equipment out of? And she said, yeah, the heart surgeons put it around the heart. I said, well, if they can put it around the heart, I can stick it in the larynx. So we got some of the Gore-Tex from the cardiac people. Now the Gore company makes it. And we drill a little hole in the thyroid cartilage and then put the material in there, and it pushes the vocal fold over. Fat injection, same thing. You got vocal folds don't quite come together. Put a little fat in there, and we added insulin to make it happy fat. And that's the fat after we washed it in a urine strainer. And then we put it in a little syringe and inject it. The instrumentarium makes these in Canada, and it's a slick way to get fat injected into vocal folds. And this is the equipment we use, and this is a pancreatic biopsy needle from the radiology department that I found when I was walking around the hospital one day. And so we use 18 gauge needles and just inject it into the vocal fold. And there you can see a plumped right vocal fold after we've injected the material, and now a plumped left vocal fold. And this is the sound of this 22-year-old boy before we did the fat injection.
When the sunlight strikes raindrops in the air, they act like a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors.
Strikes raindrops in the air, they act like a prism and form a rainbow. The rainbow is a division of white light.
And the importance of it, the Center for Performing Arts Medicine, whether it's Houston Methodist Hospital or an academic center anywhere, and it can be a partnership between an academic physician and a non-academic physician. So you can involve yourself, even if you're in private practice like I was, you can involve yourself with a medical school and have both aspects. And I really think it would be great to have every major medical center in the world have a center of expertise for taking care of performing artists. And it would serve to provide specialized expeditious care for a select group by physicians who really care about performing arts. And surprisingly, many, many physicians really do. This is the leader of the Center for Performing Arts Medicine in Houston, Robert Jackson. He's a master of the American College of Physicians. There are very few of those. This is Jefferson Todd Frazier, who runs the Center for Performing Arts Medicine, have 31 people working under Todd Frazier. He got his undergrad degree at Eastman School of Music and Composition and his master's in composition at Juilliard. He's done many great things in the country, and he's in charge of the Center for Performing Arts Medicine and all the research we do. Carol is the senior vice president of Houston Methodist, and she has helped us get all these great people hired. And some of the people that we have involved in, Christopher Karnick runs the fMRI machine. We've got a Tesla 7 fMRI to look at the brain of people that are composing music, that have had a stroke and need to be rehabilitated, try to figure ways to wire around the stroke deficit in the brain. Jennifer Townsend is a music therapist, a just great person, and manages our Center of Music Therapy. We have 8 hospitals, and each of them has at least one, sometimes more, music therapist. Shay runs everything as an MBA, and Laura Duda. This is Chichilla on the inside. Una voce poco fa. And people asked me years ago, how do you get an opera singer to do that? And I said, it's hard to get them to quit. Once they see their own instrument behaving, it's hard to stop them. But anyway, it was great to have Chichilla stay with us. That's the talk. I know it's a 2-hour talk given in 15 minutes. But anyway, I'll be happy whenever Eugenia turns me loose to answer any questions anybody has. Thank you all for listening.
Yes, thank you, dear Dick. I think this is a great focus that we need to seek in our own countries and in our own environment, because we can work as a team even though we are not all together. But the idea and the concept of working in a team for performance is very, very important. And Collegium Medicorum Theatri can, of course, as platform, support these wonderful ideas. And as you know, we are going to have live discussion after this session. I thank you very much, Dick, and we shall continue with our program. But I am sure I have already some ideas to talk and discuss with you. Thank you very much. And so our next speaker is our dear CoMeT member, Professor Dr. Alfonso Borragan from Santander, Spain, and he will talk about laryngeal inflammation and reflux and MALt. He has a medicine and doctor degree in medicine from the University of Cantabria, and specialization in phoniatrics at the University of Padova con el professore Croato in Italy. He is director of the Center for Phoniatrics and Speech Therapy in Santander, Spain, and he is director in the Aula de Oratoria Communication Skills Workshop at the University of Cantabria in Spain. He has been the phoniatrician at the Festival Theatre in Santander, Palacio de Festivales, and teacher at the Theatre School of Performing Arts. He has produced many publications in national and international journals and presented in national and international courses and congresses. He has developed a method of voice therapy with his working group based on proprioceptivity and elasticity. This is a PROEL method. In 1991, he developed laryngeal fever endoscopic surgery with CELFT in Santander, Dr. Riancho, Dr. Diaz, in Verona, Dr. De Rossi, and in Cesena with our dearest Dr. Ricci Maccarini Andrea. He has taught the prevention of voice disorders with online courses for voice professionals in Spain since 1999. He is the director of the blended learning course, expert in the proprioceptive elastic method in the treatment of voice disorders at the Menendez Pelayo International University. And as I told you before, this is not so easy to shorten the very long curriculums, and I thank you very much, dear Alfonso, querido Alfonso, for this presentation that I am sure everybody will enjoy. Thank you very much.
Thank you very much. I have had a lot of problem with the connection today. I don't know why. Sorry.
We are seeing more and more the diagnosis of laryngitis caused by reflux. Nevertheless, I have my doubts about this from what I see in my clinic and the results from therapy and surgery. In this presentation, I wish to raise a few doubts and offer some alternatives. In this first case, we can see widespread reddening of the vocal fold, of the arytenoids, the interarytenoids area, and the trachea. There are also capillaries connected to this. We can also observe a protrusion of the right vocal fold at the middle third, posterior third position. This reddening also extends to the mucosa of the posterior cricoid lamina. In the piriform sinus, we can see inflamed lymphoid follicles and capillaries. The interarytenoid muscle is reddened and displays fasciculations. The protrusion of the vocal fold, seen through a close endoscopic image, reveals an intracordial cyst and a breakdown of the mucosal wave at this level. All these injuries can correspond perfectly to laryngitis caused by reflux or a posterior laryngitis. Treatment is usually carried out by means of proton pump inhibitors, gastric mucosa protectors, intestinal movement accelerators, or diet. In addition, vocal therapy is added in order to eliminate vocal overload and traumatism. However, improvement of the symptoms after treatment is only positive between 40% and 50% of patients. What happens in the remaining cases? Is the patient to be blamed for not carrying out the therapy in accordance with our instructions? Does the reflux persist despite treatment? There tends to be a fact that repeats itself in many of these patients. This can be seen in this second case. The larynx is still inflamed with widespread capillaries. The Morgagni ventricle is open and appears to be normal. There is posterior glottic insufficiency, piriform sinus with clearly visible capillaries. The trachea has signs of inflammation. Everything indicates a new case of laryngitis caused by reflux. However, if we observe the rhinopharynx we see that there is very active adenoidal tissue and is also hypertrophic and reactive. The Rosemuller fossa is free with no accumulated tissue, and this is a good sign because the inflammation may not be chromicized. The velopharyngeal closure inflammation is competent, and the opening of the Eustachian tube is slow but functioning. The posterior wall of the pharynx has many reactive lymphoid follicles. Based on these facts in the rhinopharynx, I would not dare to say that inflammation we can see at the laryngeal level has been caused by a reflux. I would venture to say that it is originated from the upper respiratory tract. Treatment would be completely different. Nasal cleansing with anti-inflammatories and disinfectants, nasal respiratory exercises, and local and general activation of the lymphatic circulation. Gentle physical exercises with contraction, relaxation, for example, walking. Diaphragmatic breathing at rest. Another diet that promotes a more fluid lymphatic circulation. Reflux laryngitis, adenoiditis, or both. In this new case, we observe adenoidal hypertrophy of 2 out of 3 degrees in an adult whose Rosemuller fossa are occupied by tissue. This is a professional singer with many vocal problems. She is a lyrical soprano. We observe an accumulation of mucus and saliva in the rhinopharynx. The velopharyngeal closure is good, but is pathological, because it is working on inflamed tissue, full of mucus, and the mucal flows is enormous. All this mucus will end up at the glottic plane. The opening of the Eustachian tube is very small due to the adenoidal hypertrophy, and this will impede fine auditive perception. The laryngeal endoscopy reveals a bilateral protrusion in the anterior third, middle third, in a bilateral way, a vergeture or diminishment of the thickness of the lamina propria, glottic insufficiency in the double gap, and many signs of inflammation that could lead us to diagnosis reflux. However, if we have this upper respiratory tract scenario, we prefer to initially consider that the origins of the laryngeal lesion are associated to the rhinopharynx. Vocal therapy was performed along with cleansing of the rhinopharynx, and as we had limited improvement, we performed a surgery of the nodular injuries and a bilateral implantation of fat to produce beta closure. In addition, we carry out an adenoidectomy with laser. All this was performed under local anesthetic using a fibroendoscopic phonosurgery. Results were excellent, and the patient was able to resume her singing and regain 100% control of her voice. In this case, the accumulation of mucus is very apparent. The free edge of the vocal fold is irregular with scarce contact in the mucosal wave. There is anterior glottic insufficiency. All this can point to reflux laryngitis. We carry out the trumpeting maneuver, blowing with lips closed and not allowing the air to escape, in order to bring the laryngeal frame forwards, and we see the lymphoid buttons in the mucosa of the cricolamina and on the walls of the pharynx. We also observe a button pharynx with wide lymphoidal follicles that we relate to alteration of the MALt. The MALt, mucosa-associated lymphoid tissue, or lymphoid follicles, are clusters of lymphoid cells without any specific organization or structure, and also lack a capsule of connective tissue. This mold is to be found in the lamina propria and in the intraepithelial level. It is also found in the digestive system, in the respiratory, in the genitourinary, and in the conjunctiva. In the respiratory system, it is not only in the bronchia, but also in the nose, pharynx, and larynx. In the upper respiratory tract, it forms the Valderia ring, where there are packets of lymphoid cells, the amygdala, and diffuse lymphoid follicles. When the mold reacts to an aggression with an immunological response, for example in a celiac, the response is not only at the intestinal level, but also in the other place, such as the level of the Valderia or bronchial level. For us, the relationship between the intestine and the Valderia ring is very clear. An allergic person, one with intolerance to certain foods, a person with autoimmune disease, a chronic illness that causes great immunity expenditure, can have problems in the Valderia ring and dysphonia as a secondary effect. I would like to remark that an inflamed larynx is not always a sign of reflux. In this video, we see large inflammation that is associated with adenoidal cryptitis that is solved by local treatment. But in this other case, surgery was necessary on the chordal lesion and on the adenoids. And I would like you to see what happens when we perform a marsupialization of the adenoidal tissue. Green mucus flows from the interior of the tissue. I would like to leave on the table all these queries I have when I see a laryngitis. Has it originated due to gastroesophageal reflux? Is the origin in the adenoids? Or is it a widespread affection of all the mold? I would like to conclude by saying that the larynx is an organ that belongs to the immunological system, and that any immunity reaction is going to affect the mold, as well as the vocal fold, because they have the laryngeal amygdala both in the true vocal fold as well as in the laryngeal ventricle. When we see a non-specific laryngitis associated to an infection or inflammation of the adenoid or the nasal passage, we prefer to diagnose for a laryngitis associated with MALtitis of the upper respiratory tract. This will modify the treatment chosen. The voice starts in the nose, and therefore we need to have extreme care so that its function is the most adequate as possible for the person and the environment they live in. It is necessary to improve nasal physiology. When the non-specific laryngitis is associated with the presence of lymphoid follicles at the pharyngeal level, with intolerance to certain foodstuffs, symptoms of diarrhea, gases, intestinal discomfort, normally of an intermittent nature, we prefer to opt for the diagnosis of laryngitis associated with MALtitis originating in the intestine. Therapy must be oriented towards finding the most precise gastroenterological diagnosis where possible. The restriction of foodstuffs such as wheat or milk proteins manufacture foodstuffs, and to promote good intestinal hygiene. The pharynx is a great telltale as far as the intestine is concerned, seeing that the amount of mucosa is very considerable, 1,400 square centimeters. We need to regard the lymphatic drainage work, the movement or the reactivation of lymphatic circulation, as being worthy of our study and research so as to better understand dysphonia. In most cases, we stimulate this with gentle walking, walking in a swimming pool, or self-massages while in the shower. It could be a fascinating new thought that the larynx is linked to the immune system. And if this is true, we should ally ourselves much more closely to the specialization of immunology. We, however, would be placed at the center of the immune system because it is in the rhinopharynx where the first control of contact with the exterior takes place. Thanks.
Thank you very much, dear Alfonso. And you are focusing on a very important issue, and that is that the complete examination is compulsory for artistic voice performers. So we shall discuss about this connection that we have been talking about for some years, and that you very nicely showed us in your video. I thank you very, very much, because we have to widen our way of thinking, and not only thinking, of course, it is not our group idea, but not only thinking on surgery, or not only thinking in trying to solve everything with the wonderful voice therapy, and not only thinking on larynx. We have to think about the complete body and the complete neurovegetative system. And I thank very much our dear Professor Dr. Josef Schloemicher from Austria, that is going to present and to talk about the importance of pH measurement in silent reflux in professional singers. And our dear Joseph, as you know, Secretary General from CoMeT, he has been have a voice training as a baritone at the Conservatorium of Music in 1982, and at the University of Music and Dramatic Art in Graz in Austria in 1986. His career in music began in Graz also. He studied medicine at the Karl Franz University of Graz, and he is a general practitioner in Graz and Leuven, and became a specialist in ENT at the main hospital in Salzburg, Austria. Since 1996, he is consultant doctor of the Salzburg Festival for the Voice Care of the Singers and for the Occupational Medicine of the Salzburg Festival, among other occupations. His focus is on the care of the professional voice, and he is founder of the Austrian Voice Institute and the International Voice Symposium in Salzburg since 1996. From 2009 to 2013, he was a member at the Salzburg Parliament and healthcare expert of the Socialist Party of Salzburg. And since 1996, he works his ENT office, and got in 2015 the official license for the International Voice Center Austria from the Salzburg government, and also he has his professorate from this year 2022 from the Austrian government. Thank you very much, Joseph. So I shall read the presentation because Joseph was a little bit ill and I don't hear properly the audio, even though it was with audio. So we shall begin the presentation on the name of Joseph, please, if we let it run. And there are some problems with his audio. And so we shall begin with this measurement presentation that he's doing. Please, if you let him, so there are many life problems at the vocal artist, says Joseph in his presentation: inadequate sleep, increased body weight, dinner just before bedtime, the habit of midnight snack, lack of breakfast, lack of physical exercise, the habit of quick eating and fast food, and a wrong dietary regime, as we know in our daily practice. All Collegium Medicorum Theatri members know that. And in this case, one, the daily enemy of the voice box, as Joseph points. For example, in this high professional soprano, 32 years old, gifted singer, with several cancellations every year, and we know it's terrible for the performers with chronic laryngitis. And also she has bronchitis and asthma, so allergy, chronic, and of course laryngopharyngeal reflux and vocal fold viruses that she had stripping of them. She has an allergic disposition to different pollens, and also she has histamine intolerance. He was first vocal fold hematome in August 2011, and then she had again an hematome in 2012 and again in 2012. She has a consistent PPI therapy twice a day with 40 milligrams Nexium, and Joseph performed rested pH metry and also argon plasma coagulation of ectopic gastric cells made by the gastroenterologist, and also she had a hiatal hernia. So as we see in this case, she was a very important focus on funduplication because it was important. And as we know in this group, the main examination, video stroboscopy, but also due to the vicinity of the digestive system, gastroscopy, the pH measurement that Joseph made, of course also esophagus manometry, allergy testing, histamine testing, and of course the index of reflux index or singing voice handicap index are important also for our patients. The examination with the gastroscopy was important, and as said, she had a hiatus hernia 3 centimeter, reflux esophagitis, antrum gastritis, ectopic gastric cells were found also in proximal esophagus. Argon plasma coagulation was performed, and also the treatment with PPI with Nexium, but after the gastroscopy, what was only 20 milligrams twice a day. As you see in these cases, you can look at the stroboscopy, and also, yes, if you play that, please. No, okay. The next one, we keep on talking, sorry. And here you see very clearly the different varices. And also, Joseph performed this pH with double proof placement of this equipment, because this equipment is measuring not only acidity but also alkalinity, and this is very important that we cannot forget, because sometimes we give antacids and PPI and we need another kind of medicines for the alkaline reflux, not only for the acid reflux. We have also many of them mixed, and this baseline that he found was this pH metry with the baseline that we know it has to be 5 to 8, and he found this. And also this kind of pH metry give us also the possibility, for example, to have to know how much acid and pepsin is coming to our esophagus, through our esophagus to the larynx. And as we know, we should have a pH, sorry for the delay, of 6,5 to 7,5. Usually there are some teams from our members that are sending this also to the gastroenterologist. We have also here night reflux, and Joseph has analyzed the dietary analysis in seeing exactly what kind of reflux did the patient have during the night or during eating. And for example, here, what happens with cough, what happens also with orange juice, what happened with chocolate, and also with tomato juice, because as we know, many of them are not only irritant, but also they make a very bad function in the esophageal sphincter inferior. And also, of course, martini by bedtime, it's not a good advice when you have an artistic voice performance, and even though you are not at the moment having performance, you have to take care, because as we know, you can have chronic problems, and this is not so good. So as we see here, the last examination of this patient after food application with a change in lifestyle and dietary was very good. And of course, we are in our group all accustomed to these images, and we are dealing with these problems.
Okay.
I hope we can hear La Boe with this patient. If you can please play audio. I don't know if it is correctly. Last examination, back on stage as Mimi in La Boheme. And here is the audio. Okay, over there. Okay. Sorry. So the gifted voice and handicap, as you see here in this phonetogram, we can look at the different lines that the patient improve through the phone application and the lifestyle and dietary changes in life. I think the audios are not correctly put in the video. And this professional mezzo-soprano.
Streiten sich Nordwind und Sonne, wer von ihnen beiden wohl der Stärkere wäre, als ein Wanderer, der in einem warmen Mantel gehüllt war, deswegen kam. Sie würden einig, dass.
Okay, so you can hear the voice, and then after the treatment, after the vocal creases with several cancellation and ambitious and consistent stress.
Happy birthday to you, happy birthday.
Yes, completely out of balance due to these problems. And can we please play the other slide that we keep on? Okay, and then here is the video stroboscopy of this patient.
Atmen. Atmen. Okay.
And then you see some time after that it is worse, and of course has also a pseudocyst. If we keep on playing, please. So Joseph made this allergy test and also test of fructose intolerance and the pulmonological function also. He has already made stroboscopy, and he performed also pH metry and gastroscopy. And the therapy, as you see here, cetirizine, the mista, antihistaminic, diet, Montelukast and Alvesco, also immunoregulators, and of course anti-inflammatory drugs, and of course treatment against reflux. And Joseph said he can see but he cannot connect. Anyway, I shall read for you, Joseph. And the diagnostic was made with this RESTEC pH metry. As we saw already, it measures acidity and alkaline. And the next one, please. And so you see here the result, and the most important recommendations from Joseph are reflux diet, lifestyle change, elevation of red sports, new singing teacher, and of course all these limitations we do know in our daily practice, that many of our dear artistic voice performers, they are not so happy with our recommendations. So as Dick says, we have to be empathic with them and explain as much as possible. Otherwise, it is not so easy to deal with them and to see, for example, Dick with Pavarotti. How can you tell Pavarotti not to eat spaghettis when he's in love with spaghettis, as we know? But anyway, this pH metry from RESTEC gave us this Ryan score. And the next one, please. And of course, here you see, for example, what happened with the green grapes, what happened with Choco, Prosecco, Pommes frites. So if we think properly, we say, oh, okay, we have to eat. The thing is, if we are artistic voice performers, we have to think what is the best for us and in which moment of our daily appointments are. What shall we do if we have a tournée, or if we have a concert, or if we have some other problems? And for example, wine, I recommend that the last cup of wine, not after 19 hours. And of course, it's very boring, but it is the reality. The next one, please. And this is the phonetogram also from this performance that Joseph showed us in this video. The next one, please.
Birthday to you, happy birthday to you, happy birthday, happy birthday, happy birthday.
And as you see, she is singing better. The mezzo-soprano is singing better, and we can see the phonetogram. The next one. So Joseph wanted to point out the importance of pH metry that he is performing himself in his practice. So, and of course, all the things that we know that are important to focus, because even though we know that daily, we have to reaffirm that what we are recommending is the best thing in order to avoid more vocal problems or artistic voice complaints. If we have some audios, please. So the next one, please. We have to miss these small presentations. Okay, and the hypothesis is to examine the role of oropharyngeal pH measurement of these professional singers, and of course to reach a long-lasting lifestyle effect. And as we know, and everybody comment that in our chat, and we shall discuss that, PPI have complications, side effects, and everything. So we have to plan properly what to do with our artistic voice performers in order to try to avoid all these side effects. The next one, please. And avoid long-lasting PPA intake. So there is, in summary, 3 models of therapy for LPR: dietary, behavioral lifestyle modification, medical therapy, surgical therapy, and when it's indicated. The next one. And in this retrospective study with 42 high professional and semi-professional singers and choir singers, we shall see some of the results of this study. The next one, please. And we found that all these patients got initial therapy with Proton Pop to step down, and to step up, we did individual dietary and behavioral lifestyle advances. And Dr. Vox, Gaviscon, that it is also very well known in our group, optional H2 blockers, and also HOV elevation. And this statistic, many thanks to Andreas Hofer, with Mann-Whitney U-test, chi-square test for relations. The next one, please. And also you see here the soprano are with a lot of more problems. And of course, there are low-level reflux, high-level reflux, organic lesions, yatal lesions, or all together. The next one, please. And in non-singers, you do have something different, because in non-singers, in this study from Joseph, he had high reflux, and of course, the statistic measurements were also high. I am sorry that there are some internet connections, not from Mexico, but from other countries that are not working properly, and so we understand that correctly. The Ryan score in config and non-singers, and of course, all this is going to be in our webpage through your YouTube channel, that you can look very detailed to all these results. Thank you. The next one, please. Significant is very high in this study with all the changes that Joseph made for these patients. The next one, please. And the clear significance is persons with low reflux level, high and higher RSE, and the coughing has a clear correlation to a high Ryan score. And this is very important, because many patients say, I don't have any reflux symptoms, but I do have cough. And so this is one of the answers, and I shall talk about that later on. Hiatus esophagus alteration has also a clear correlation. And dietary habits in singers are the most primary reacting food. As you see here, is in this study is citrus, but we shall see in our study with allergies is different. But anyway, citrus are very, very nice to eat, but we have to be careful. And as I say, every personal diary is important. That means that we have to know, and of course, our artist has to know, what is he or she eating at what time, and which are the results in the voice. Next one, please. And taking home message for emergency, stop coughing, very, very clear with COVID. There is often a stress reflux. Take PPR in every acute inflammation for a short trail step down. And when you take anti-inflammatory drugs and cortisone, don't forget to take PPI. And also the laryngeal manipulation, Joseph does that. Laxbox and empathy is often better than pills, of course, but we cannot avoid thinking of the pathologies that we have found. The next one, please. And take food as medicines. In conclusion, from this Joseph video, the study shows the significant correlation between the result of oropharyngeal pH measurement, air as A, and the indexes scores that we know. The oropharyngeal pH measurement is sufficient tool for planning individual dietary advices. The questionnaire is proved to be a sensitive tool for the examination process with oropharyngeal pH measurement regarding planning the therapy, change of dietary habits, and lifestyle. That is why, the next one, please. That is why, and this is the invitation for Voice Care on stage. Well, Joseph is thinking that perhaps August 18 to 20 in 2023, we shall see everybody in Salzburg. I thank you very much, Joseph, and please forgive me if I made some mistakes, but I have to talk, stop coughing. You have to stop coughing because you were ill. Okay, and now we shall, thank you. We shall finish this presentation. And also, another thing that is important, this is the proposal from Joseph for the spelt flakes, oat flakes, sesame oils. This is an anti-acid breakfast. And also he's thinking, the next one please, that cinnamon, ground almonds, raspberry ginger. Raspberry ginger we have to talk about because there are some problems with ginger, even though we know traditionally is good. This is the called Dr. Wool's Gargle Secretion Thinner, and it's going to be available in our presentation. And now I am going to present myself. Thank you. The next one. I am sorry to go very quickly, but it is because of time. So I studied at the university, Universidad Nacional Autónoma de Mexico, Bravo. I got my medical doctor degree there, and I have a specialization in phoniatrics, audiology, and human communication medicine in Mexico. I made doctorate studies in phoniatrics, mainly artistic voice and aphasiology, at the General Hospitals in Vienna, at the University of Vienna in Austria. And I have a fellowship, special government invitation from Professor Jürgen Wendler in Charité Hospital at the University Alexander von Humboldt in Berlin. And I made my training in endoscopic, indirect endoscopic surgery, mainly by singers, with Professor Jürgen Wendler and our dearest Professor Wolfram Seidner. I had a fellowship in allergy and in ENT, and I am director of Centro de Foniatría y Audiología in Mexico City since 1989. I am national coordinator from World Voice Day since 2000, and for the Union European of Phoniatricians since 2013, because Mexico has the same medical specialty program as Europe in phoniatrics and audiology. I am a board member from World Voice Consortium in 2006, organizer and host the International Congress of Collegium Medicorum Theatri Experts in Artistic Voice in 2009. I am making many courses, workshops to everybody. I have activities in clinical, surgical, rehabilitation activities. And also, I didn't put that, but I used to be on the stage in theater activities since I was 7 years old until 18. Then I changed to medicine. I developed some rehabilitation techniques for voice professional users. I made many teleeducation programs for risky voice professional users, many workshops also in indirect surgery for artistic voice. And I have special, I make a personal counselor for special programs, mainly political leaders in voice use, and I have some publications. So thank you. If you give me to share, please, I shall share and I shall present this. So I'm talking again about reflux and food allergies and their treatment in the artistic voice. I thank you very much for being here with us. And as everybody knows, the stomach pathologies can change the movement of the diaphragm, and that means something very important for the artistic voice use. Also, the esophagus with inflammation can make asymptomatic reflux and pressure in sternum. And the stomach inflammation can also cause reflux eructation. Sometimes, as we know, the patient say, no, I don't have any symptoms of reflux.
No,
I don't think...
Hello.
Yes, hello.
Okay, sorry, something happened.
Don't worry, don't worry. And the stomach pathologies can also be hernia hiatal, that is giving us heartburn, reflux, breathing incapacity sometimes if we have a very big hernia. And this is incredible how in many artistic voice performers we find terrible problems with very, very tiny voice complaints. The gut inflammation can give us constant abdominal pain, meteorism, apoyo difficulties, and also we can have the presence of Helicobacter pylori with an unpleasant breath, and of course, many voice complaints. Sometimes the symptoms are only in the voice or in the larynx or pharynx, and sometimes in the nose, but not on the digestive symptoms. For example, slight dysphonia in some, mainly in passaggio, lack of flexibility for crescendo, for diminuendo, for messa di voce, or for very big intervals. The artistic voice performers can have phlegm during singing or acting. They usually complain of sometimes phonosthenia in presentations that they regularly do, and so they are dealing with these problems. They have also cough, sore throat during singing, and sometimes, as we know, we have to think about all these very tiny symptoms. But the signs that we can have in our stroboscopies and our endoscopies with different lights and different endoscope flexible or rigid with 70 or 90 degrees, this is a very important issue for the treatment of this kind of problems. So edema in the interarytenoid region, erythema, dryness, phlegm, edema of the vocal folds, and also of the bronchicles and the subglottal edema. And of course, if we see this case, we can usually say what is happening. But as Alfonso and Dick and Joseph said, we have to think universal. So we do know that many of these wonderful painting of a Mexican painter, Antonio Orozco, made about the very funny problem of the singers. We know it can be because of these problems. And also, we have to think about the dysfunction when we have this kind of signs. And do not forget that if we have in velum this kind of very hypertrophic uvula, we know that we have some problems also in the pillars of the velum. We also are dealing with this kind of signs, and in the pharynx, the granulocytes. But we do know that many of these patients have vocal cord dysfunction and can also have paradoxical vocal fold motion because of the irritable larynx syndrome. As we see in the stroboscopy, we can see also many tiny problems in the function, even though it's a professional singer. So we are dealing with many dysfunctions, but we have to think about all the other problems that we know and we have mentioned. And for example, with 70 degrees, we have, as we know, another exploration. And we can see also the pharyngeal movement to compensate the problems. And also another big problem that everybody mentioned before and everybody knows is the bleeding and the varices of this kind of patients. But also the side effects of many medicines that we usually use. As we know, all these kind of medicines that sometimes are necessary for our artists, well, we have to deal with these problems. And that is why in our live discussion, we have to discuss about risk benefit with all these kind of long-term medicines, like, for example, anxiolytics, antihypertensive, or antidepressants. Also, one issue for the psoriasis due to the reflux is, of course, the emotional situation. And we know that now in COVID time, stress and conflicts are more and more. And for example, this singer, as you can see the many problems that he has. So for the examination, as everybody knows, I just want to resume that, is a pylori test. It is very important to test it. And very surprisingly, during the pandemic, I have had many positive tests, more than usually, with Helicobacter pylori. And usually I make in blood, but it is also possible to make in excrement, in breath tests also. Usually now, because of the pandemic, we are making more barium gastroduodenal radiography, but it is also advisable to have a panendoscopic with gastric examination, the pH-MET3 that Joseph already presented. There are some other pH-MET3s, and the esophageal manometry with impedance. But also don't forget about the gut, because colonoscopy is sometimes compulsory, and also to think about parasites and bacterial colonies. For example, Clostridium difficile is more often. And now talking about food allergies, because everything is all together. But we know that food allergies are due to an immune response where antibodies will appear produced by lymphocytes, as we know. The more exposure you have to these antigens, the more antibodies you have in reaction, and that means that you begin with the cascades of immune events, having a IgE antibody that is produced when one is exposed to an allergen. But for example, if you are drinking milk daily and you have allergy to milk, well, you have problems. And of course, as we have seen all these years, we have to think about an allergenic overload. That means respiratory allergies, the exposure that we have on stage or at home or on the street in the environmental polluted areas. And also the pathologies that we can have in nose and sinuses, structural pathologies. We do need to make a differential diagnosis with functional disorders, occupational voice disorders, neurogenic pathologies, and medicine side effects. The balance in food intake is very important, not only quantity and quality, but also in schedule. And sometimes our artists are not so easy to have a schedule because they are traveling through the roads or they are going to concerts where they cannot eat or things like that. The food effects in general, because of irritation or allergy, are secretions from the milk products. Chile, that you know, Mexico will love chile, but it is wonderful to taste it. And of course, in Texas, we have also altogether chile, but we can have also irritation. The allergy in Chile, surprisingly, is not so high as milk products, but irritation is high. Also cola and coffee and tea. And the dryness from alcoholic beverage is important to notice. Also the secretion for chocolate. If you don't know, of course, I have to give announces that chocolate and tomato were souvenirs from Mexico to the world, as you know. Okay, peanuts, nuts, and almonds can also have dryness and, of course, allergies. And the food allergy in general, so as tradition, we know chocolate, peanuts, nuts, but also things like tomato, garlic, apple, soya, and onion have also a direct influence on the esophageal inferior sphincter. Alcoholic drinks can also cause change in the nervous control system that an artist has, a lot of dehydration, and of course, respiratory and digestive problems. So we are dealing with different things in this area. Food allergies, structural changes that everybody knows and talk, and changes in the gut microbiome. In our group, until last year, December last year, we had a total of 962 voice patients with allergy tests in blood, and from this group, 85% are artists. And we notice here in the female group that the majority, so a great percentage, have milk allergy, and then beef allergy, egg allergy, apple allergy, tomato, garlic, and so on. And in the males, also milk is number 1, beef is number 2, and then the other ones. But I do not think really that we have to avoid this, because not everybody has an allergy, and we shall discuss about that. The gut microbiome, as we know, is very important because we have to avoid this dysbiosis that can be caused by many other problems, like food allergy also make this dysbiosis. But also this dysbiosis, when the epithelium of the gut is inflamed, the increased level of angiotensin converting enzyme has a lot of influence that the pathological bacteria or virus can stay there or inflame more and make problems like COVID-19. So the allergy diagnosis we have been making that through blood, because in blood we can test all the respiratory allergens that we need, also the industrial allergens, for example, all kind of latex or wool or cotton, and also food allergens we can test. Of course, it has to be personal, but I have like a protocol. We usually make the test for the general kind of hidden food that it is, for example, like maize or wheat. Sometimes they are hidden in the food because it's on the industrial processing that they be needed. Also, the examination of upper and, if necessary, lower airways complete, and if necessary, allergy. And this treatment, well, is as well known from all our group: proton PPI, antacids, prokinetics, antispasmodics, probiotics. We do know that many prokinetics are not allowed in many countries, but we shall discuss about that. And reflux hygiene, as everybody said before me, well, I don't have to repeat that, is very important. The intake in schedule is also very transcendental. For the allergies, we need pharmacological treatment. Desensitization, I cannot. I tried to improve my word, but I don't get it. And the vaccine for this desensitization, rotary diet, avoid chemical load, and of course surgery. But please do not forget that we have cross reactions. For example, if we are allergic to wheat when in the respiratory tract, we can also be allergic in the digestive tract, even though the symptoms are not there. Don't forget, we have to think about signs more than symptoms. In general, in our group, because of the sensitivity of the artistic voice performers, they have more sensors for other things than the regular population. Usually, my experience is desloratadine, Avastin, levocetirizine, and fexofenadine. We don't use the other ones because they are having a lot of side effects in dryness, and it is against voice, as we know. mucolytics in nebulizators, and of course the immunotherapy. And another kind of treatment is inhalotherapy for hydration, water, steam, or nebulizer, purifying the environment, and of course, if necessary, voice therapy for singing voice, for acting voice, or for regular voice. Hydration, breathing exercise, balanced food intake, avoiding smoking, talking about alcohol intake. If they are persons who are with sickness of alcoholism, we have to go to professionals, other drugs as well. Sleep, management of stress, and sports. And in conclusions, reflux, acid, alkaline, or mix needs to have a complete diagnosis and a complete treatment. Do not forget there are reflux cases without digestive symptoms. And the immune system, as we have seen in these talks, and many of you already know, plays a special place in digestive pathologies. And we have to reinforce the good microbiome. Is very important. Food allergies have to be investigated in those patients with respiratory allergies and with signs of reflux. Food allergies need to be treated, diminish the allergenic overload, respiratory, digestive, and chemical. And controversies, we are going to talk about that. Voice complaints, larynx complaints have to be analyzed in detail because, as we know, many persons, they say, it is not necessary, it doesn't exist, whatever. But as artistic voice experts group, we have to analyze all these details. And as we know in our daily practice, if an artist comes and says, I cannot do that, we cannot think about only what other groups make. Oh, these artists, they are just like exaggerating everybody and they think they are the first in the world and the unique in the world. Well, they are because they are artists, but they do have problems. And we know in our daily practice that we agree with them that they have problems. Thank you very much for the attention. And I am sorry to run, but we are on time. Thank you.
Dear CoMeT members, I thank you all for accepting me in this prestigious collegium, and in particular I want to say thank you to President Eugenia Chavez and to Dr. Franco Fussi. I feel very honored to be part of CoMeT. My name is Eleonora Bruni, I am 58 and I have always been involved in music and in singing. My father was a trumpet player and he led me to learn about great music from jazz to opera. I am a singer, singing teacher, vocal coach, and I am professor at Bologna University since 2009. I live in Rome, but I travel a lot. As a singer, I sang many different kinds of music, jazz, rock, experimental music, and I sang musical theater for many years, especially rock operas, Jesus Christ Superstar, Tommy Hare. I have recorded 7 albums. After high school, I studied at the Sapienza University of Rome for master's degree in literature and linguistics, and then at Tor Vergata University of Rome for degree in education and pedagogical science. I studied singing and music at St. Louis Music College and then at the University of Music in Rome. They are 2 prestigious private institutes. I also had many private singing lessons and I attended the seminars and workshops, discovering many methods and many approaches to singing pedagogy. I study even now. When I was young, I did a lot of jobs to support myself in my studies, and for 5 years I worked as assistant with psychiatric patients, just like my friend Erika. In 2008, I attended the artistic vocology course at Bologna University. It was a great experience, and at the end, in 2009, I won the Vocology Awards for the best thesis. And in the last 20 years, I developed a great interest in non-conventional sounds and in supraglottic noise. I created a method to teach how to achieve safe distortion and noisy sound, and is the training Bruni. The artists and the students learn how to produce a noisy sound without danger and how to mix sound and noise. With Dr. Fussi, we have carried out a research about the supraglottic source, and we realized that the training can be helping speech therapy for patients after laryngectomy and also in functional dysphonia, as we wrote in this book. I hope to collaborate with CoMeT members to carry on this research, both for artistic aspect and the rehabilitative ones. In 2012, I started a very important collaboration with a fantastic, incredible person that is Erika Biavati. Now she is my best friend and we talk about everything. We started working together, first focusing on extreme voice and then on intermethodological pedagogy of the artistic voice. Together we created an intensive course for singing teacher. The name is Voice to Teach, and with a fantastic team of 7 teachers. In 12 edition we had more than 300 students. And I love this course very much because to build it we had to ask ourselves many questions and we had to study a lot. Currently I am a teacher at Artistic Vocology University Master, Clinic Vocology University Master and Circle Singing course. I love to improve artists for the performance and for the stage. As a vocal coach, I teach many career singers and artists, and I am with them traveling on tour, in album recording, in theater, in big concert, in stadium and in arenas. I teach actors, dubbers, but above all singers of all styles, from pop to rock, from rap to trap, from musical to classical singer. I have attended many congresses all around the world and I contributed with lectures and practical workshops about supraglottic, voice pedagogy, posture, body and singing. At the moment I am conducting a study on the role of the hyoid bone in light and heavy emission together with Franco Fussi and Valentina Carlisle. In my free time, I love traveling to know cultures, music and habits, but I also love to be in my house, on my sofa, with my family, reading a good book, warmed by my cats. I thank you again for accepting me in this collegium and I look forward to contribute for the research on artistic voice. Thank you very much for your attention.
My greetings to all the members. My name is Giovanna Montecalvo. I'm a teacher, a jazz singer and performer. First of all, my thank you for this great opportunity. Being here is an honor full of responsibility. I'll tell you about my work in a few minutes. I graduated in classical piano, opera singing and jazz music and obtained the master in jazz music with full marks, honors and mention by discussing the final degree work entitled The Voice Between Science and Art. This work contains my thought and my research on the teaching of jazz singing and improvisation. I'm expert in artistic vocology and I'm a still master teacher for a still voice. I have been teaching voice and singing for about 30 years. I have been jazz singer teacher in various conservatories in different cities. And finally, in 2013, I have held the chair of jazz singing at Conservatorio Niccolò Piccini in Bari, my city, where I also hold the position of coordinator of jazz music department. Since 2010, I have been a professor in advanced vocology artistic course in Ravenna, currently a master under the guidance of Dr. Franco Fussi. I am a member of the scientific committee of IARC International Academy, a center that intends, with the tool of scientific research and teaching, to make a change to knowledge. My research has always been directed towards tracing a useful way to connect the two aspects of science and art in the definition of a clear and verifiable teaching. Therefore, I could consider myself a researcher of didactic strategies. In last years, I have directed all my energies into the search for a teaching methodology that, through the no-idiomatic improvisation, leads to a bodily consciousness of the voice instrument in a possible definition of a sound map useful for revealing original and personal expressive contents. I have brought my study work in a lot Italian congresses, especially the Artistic Voice of Ravenna and in the University of Bari, collaborating with humanities and scientific departments. My career has always been divided between the activity of teacher and performer, and it still rich and continuous. I have many record releases to my credit, and my repertoire ranges from the songs of jazz American tradition to jazz avant-garde, from radical improvisation to contemporary music. I was lucky enough to collaborate with great musicians in Italy and abroad, performing in various countries as the United States, Russia, Albania, England, Germany, and also to record for prestigious labels as Sonote, awarded 6 consecutive times as the best independent label by the famous magazine Downbeat, Leo Records, Angel Records. So I'm here to give my contribution and my experience as a teacher, and for that I want to greet you with what I believe to be my constant thought in the teaching and in the pedagogy of the voice. The didactic is a fair balance between the knowledge, the bodily awareness, the lived, and the intuition. Thanks so much.
Dear CoMeT members, I thank you all for accepting me in this prestigium collegium, and in particular President Eugenia Chavez and Dr. Franco Fussi. It is a real great honor for me. My name is Erika Biavati, I'm 40, I live in Bologna, a town in the northeast side of Italy. I'm a singer, singing-songwriter, singing teacher and professor at the university. When I was very young, I discovered a great passion for music, and I started singing and playing different kinds of music, from soul to blues, from pop to rock, and at the same time I started taking singing lessons to improve my vocal technique. I'm a singing songwriter. I recorded some albums and I won important prizes. I've also had experiences as line-up vocals in the Italian tour of the songwriter Bill Toms and in recording studios for other artists. I attended many private lessons, courses, workshops and masterclasses, discovering different singing methods. During my singing studies, for 14 years, I worked as assistant with psychiatric patients, and at the same time I started teaching singing. In 2009, I attended artistic vocology course at the university, and it has been a perfect occasion to study the voice with an interdisciplinary approach. At the end of this formation, I won the prize for the best didactical thesis. The topic of this thesis was the whistle register. Since I was young, I used to sing with whistle register, and then also during live concerts and recording sessions. Then I tried to teach this kind of emission to my students. With Dr. Fussi, I carried out a research about mechanism 3, looking for anatomophysiological characteristics and didactical strategies to produce it. And in the last 12 years, I've held many courses and lessons about whistle, and I'm currently writing a scientific article about it. I hope to collaborate with CoMeT members to carry on the research on whistle register, because I think that it's necessary to go into detail about some aspects of mechanism 3. In 2012, I started a very important collaboration with a person that now is my best friend. Her name is Eleonora Bruni, a wonderful Italian singing teacher, new CoMeT member like me. We started working together focusing on extreme voice. We held together many master classes and we conducted a research with Dr. Fussi about the effect of extreme voice on mechanism 1 and 2. Eleonora and I used to have an intermethodological and interdisciplinary approach in our job, and we decided to focus on the pedagogy of the artistic voice, creating an intensive formative course for singing teachers named Voice to Teach. We built a team of teachers composed by Eleonora, me, Dr. Fussi, 2 speech therapists, and an actor and a psychologist. It has been very successful. In fact, until now we had more than 300 students. In 2011, I founded a music school named Live Music School, where I am the director. Almost 3 years ago, I wrote a book named Mix and Belting Emissions in Comparison, and currently I'm teacher at the Artistic Vocology University Master. Since 2020, I'm professor at the Bernstein School of Musical Theatre in Bologna, a prestigious academy dedicated to the formation of musical performers. I've attended many congresses all around the world to learn more and more about the voice, and I've used my experience to contribute with lectures and practical workshops about whistle register, about voice pedagogy, and about the use of semi-occluded vocal tract exercises in singing lessons. When I'm not engaged with my job, I love spending my time with my animals, because I have 3 dogs, 3 cats, 3 turtles, and lately I have had also 5 lovely hens. I thank you again for accepting me in this collegium, and I look forward to contribute for the research on artistic voice. Thank you very much for the attention.
Well, this was a wonderful presentation, and now a saludo, greeting for the great Tran Quang Hai, rest in peace. Thank you, Tran, for being you. Collegium Medicorum Theatri likes you very much. We love you, Tran. We love you. Last time I saw you was in Ravenna. We really love you. And thank you, Franco Fusi, because you sent us this very nice presentation of Tran. It was the last time in Ravenna 3 years ago. So, Tran, you gave the artistic voice world a great of your talent. Thank you very much, Tran, for being such a wonderful person and such a lovely and interesting teacher. My dear friends, I thank you very, very much for being with you today. I am sorry that there have been some problems with the communication. As you know, each internet of each presenter has to be as good as possible, but sometimes it doesn't work. We do know that. And I am also sorry that I had to help Joseph, and of course we have more time and from our program. And also I want to motivate you for two very important things. First of all, our next Zoom meeting will be on March. As you remember from my mails and for the programs in our webpage, we have fixed dates for the next Zoom meeting sessions. I understand there are many activities and many appointments and dates and everything, but I would love to see you on the next Zoom meetings. That, as we know, they are longer because we wanted as that in the General Assembly. So please look at the dates, and very important also, if you want to contribute to the next one, of course, our theme is hearing, because we are celebrating World Hearing Day. Do not forget, World Hearing Day is on 3rd of May. Can we put all the videos, please? Carlita, thank you. And of course, we are celebrating this World Hearing Day. Catherine Neumann, our dearest friend, that she's also a great cellist, as you see in this wonderful concert that she shared with us, and with Philip. Philip, countertenor, is also a new CoMeT member 2021. So I am sure he will show his video next time. So I want to motivate you to send your presentations. If you don't have anything about hearing, okay, please send them. We are going to have on the next presentation hearing, we are going to have a presentation of Alan Burma, very interesting about the self-hearing of each singer. Of course, I am not telling the exact title. Of course, Catherine Neumann, that she is working with the World Health Organization in hearing problems. She is going also to give a presentation, but everybody is welcome to join with presentation, but mainly with your presence. And the second thing I want to motivate is about the great ideas and the great experience that our Dick Stasny made about this team group. We have seen all through these years that Collegium Medicorum Theatri is a perfect example what a team can have. For example, we hear Eleonora, we hear Giovanna, we hear Erika. Last time we hear Alfonso with his group, and of course Soledad, and many of us have also teamwork, and this is really great. So this second motivation is wonderful because our dear Dick can help us with his wonderful experience from this Performing Arts Center at the Methodist Hospital, and also he has been collaborating and directing many of the groups in the States. But I do agree with Dick, and this is a great motivation, that everybody has to do the same in their countries, in their cities, in their groups, and whatever. Another thing that it is important that I want to apologize, because due to some technical problems with PayPal, our dear Ron Scherer, I'm sorry, we had some problems with the payments. So I do welcome, of course it is now closing, but we shall have the discussion to Ron Scherer that he was all the time with us, and also Ron Scherer, our dear Ron from the United States, and Reinaldo Yasaki from Brazil, Giovanna Barraca from Italy, and our dear Peter Hulin from Germany also join us today. So we are really a wonderful group. I know many of you are complaining with the family and accepting the complaints from the family because it's sad today and things like that. But I think we have made a great group trying to be together and to discuss all these issues that are so important for our patients and of course for our world. Do not forget, Erki Bianco is having a structure about vocal normal falls with dysphonia, and I shall send you very soon as possible, all the structure for COVID and artistic voice statement from CoMeT. So if you want to leave, you may leave, but I would love to have you here because now it's the live discussion. I thank you very much, and I also thank you for your payments, and you can use Wise or PayPal, and also you can use the bank account from Europe. And do not forget, Collegium Medicorum Theatri is present all over the world, and we are having presence with Tallinn in Estonia, with our dear Alan Burma in August, and we hope we shall have Tel Aviv with our dearest Adi Primo Fever and Ofer Amir in Tel Aviv, Israel in October. Let's see what Corona says. But anyway, please open your videos because we are beginning with the live discussion. And as always, I am going to moderate. And if somebody wants to begin with some question, yes, Dick?
I just want to thank Joseph. When we had a meeting in Salzburg, I had a good friend that was singing the soprano lead at the opera, and Ana Maria Martinez, and I saw her opera, and then I toured the Salzburg Opera House, and they have a room right near the entrance to the opera house for a healthcare provider. And I just thought that was so important, and it's like having a healthcare provider on stage for the audience and the performers. And Joseph, that was genius. I thought that was great.
Yes, yes.
Yeah, many credits to all. I had technical problems, and I saw you, but I saw only the video from Eugenia and from the speaker. And then after, at about 7 and 10, I got advice from somebody. He opened my video. Okay, now I'm here. And congratulations, Eugenia, for the wonderful presentation of mine.
Okay, yes, I think, well, thank you, Joseph, but it was terrible because I was not prepared, even though I know because I have to see all these videos.
You know
Anyway,
me.
I thank all the audience that they support to hear me twice. Joseph's interpretation, Eugenia's style with many mistakes, and of course mine. And I agree with Dick, because this is what he says about what happens in Salzburg with Joseph. This is very important because, as we know, if we have in Collegium Medicorum Theatri the connections to persons like us that are interested and are working with artistic voice, it's wonderful to have a team. Because I had some questions to Dick. For example, what do you think, what is your experience, Dick, with the hearing loss of the violin and the violas, and of course the articulation of the joint articulation of the mandible, because of all these situations, special when they are also singing, because in popular singers there are many who are making both. They are instrumentists and singers. I don't know, what can you think about this, Dick? And also another question for you is if you have in your teamwork also dentists and orthodontists.
We do, and you're quite right. We screen the Houston Symphony hearing every year for several years, and we found that you don't have a hearing loss because you're sitting in front of the horns. You have a hearing loss because you're playing a violin. And the most common hearing loss we saw in symphony orchestras was a left ear and violinist. And I think Seattle does the ring cycle every year. And they put sound pressure meters all over the orchestra pit, and found that it's a long, Wagner operas are long, but there's not that intensity of sound except from your own instrument. So they didn't see a lot of hearing loss in the orchestra.
Sorry, Dick. Marco, I think your micro is open. Marco Fantini, please. Sorry, Dick.
No, what I would love to have, Eugenia, is either a instrument manufacturer, Yamaha, Kahn, somebody endow CoMeT so that we've got some money. And I don't mind paying dues every year, and I think $40 is cheap. And I sent you the money directly with PayPal, and you can do that. Just send it to the individual, not some CoMeT account. And I assume that you'll put it in the PayPal account, in the CoMeT account. But it'd be nice to have a drug company, somebody, or maybe several, endow CoMeT so that it has the funds to really take it to the next level, and not. And then we can have meetings, and we're not dependent on somebody pulling out their credit card and subsidizing the meeting up until the day the meeting starts, because you never know whether you're going to be in the hole or make a slight profit. And that was my deal in Aspen. I had to put $40,000 on my credit card to insure the hotel rooms and the place that we had the meeting. I had to pay for all those in advance just to hold them. And then fortunately, I made $50. I got my $40,000 back because the Japanese finally came and gave presentations, and they were the last to come in and take a hotel room and make presentations. But it was a nail biter up till then how much was going to come off my credit card. And it would be nice for CoMeT to have some money they could just draw a certain amount to cover these venues, so that then wherever it is, we've got hotel rooms that are relatively inexpensive. Aspen is extraordinarily expensive, as you know, and to get them for half price, you have to pay up front. But it would be nice to have that if we can just have a little slush fund of money that is in the CoMeT account. And we can do all kinds of, we could do research and combine. We could recommend Joseph's concept there at the Opera House in Salzburg all over the world, and have a doctor sitting in, or a nurse practitioner sitting in an opera house or any concert venue all over the world to take care of the audience and the performer.
Yes, yes, please, Reynaldo, do not leave, because you are important. Do not leave, Reynaldo. Thank you, Dick. Yes, I agree with you, and let me speak, Joseph, and then I say my opinion. Yes, Joseph.
Yes, I agree with Richard, but maybe I'm a little exotic person. I'm a common doctor, I'm an occupational doctor, and I'm an ENT doctor, and I'm interested in voice. It's my specialty. I think we should make contact to all opera houses and make familiar to our experts of voice, very close. They should have a close doctor in the near. Maybe somebody is a common doctor and occupational doctor too. This is the best, because I'm within all decisions in the house. I'm in the level of directory and in the department of occupational medicine, and the voice medicine is my hobby. That is the basic.
Well, yes. Okay, this is a position, but what I think is that the idea to be universal and to work close together is a wonderful idea, because in the team, everybody has to understand that the body, as I say, the body is the structure where all the instruments are. The structure, but it's only one structure. So it has to be examined by a specialist, but all together working as Dick has this experience. I think this is wonderful, because you can understand many things, but also, for example, you can say, okay, you have hearing loss because you are a violinist and you have this kind of hearing loss, but how is it working if this violinist is having also allergies, as Reynaldo said, and ask what happened with the turbinates when you are making more pressure, if you are a violinist, but also you would like to sing or to play trumpet. So I think this is an exchange of knowledge between all these specialties, and I think this is very important. And I completely agree with Dick that we have to be all together, even though, Joseph, you have these both specialties, but not everybody has these specialties. For example, in Mexico, we are phoniatrician and audiologist. In some other parts, the audiology is belongs to not to non-medical professionals, like in the States. But in Germany, they are audiologists for children and things like that. So I think we have to be together and to join in this concept of teamwork. Otherwise, of course, we are the experts and we are completely passionate with the voice, but we have to hear the others what they are telling, and we have to tell them what is happening with the voice, because the voice is not only in singing and acting, the voice is in the daily use. And if the violinist sings and he's shouting because of the hearing loss, well, I agree with Dick, because it is not so easy. I don't know, Ron, if you have some experience with all the research you usually make about the voice, hearing, and many things. For example, in the presentation that your doctorate student made about mask face and things like that, what would you be your concept, Ron?
Well, I don't have a response directly to that. Can you hear me okay?
Yes, perfect.
But I do have two aspects that I'd like to request, actually. One is that this series today about reflux reminds me that speech-language pathologists in training, the master's level students, what they get is what we as the professors, tell them about reflux. But what I would like to see is a statement for that educational portion of the voice disorders course, basically written by a laryngologist about what an SLP, before going out, needs to know about reflux in particular. And the other idea is that it's been really hard relative to arts medicine to create arts medicine in the regions that I've been in. And I think one of the reasons for that is that there probably needs to be a pamphlet that can be distributed to regions like mine, which is Northwest Ohio, where the pamphlet would basically set the criteria and the do's and don'ts about how to set up a reasonable and effective arts medicine group. Our opera company has an individual, but I don't believe that there is a full team involved with the ballet, the opera, the orchestras, et cetera, in my region. So kind of instructions from the arts medicines group, and maybe they exist.
Ron?
Yeah.
Yes, Dick.
Todd Frazier, the composer, the Eastman Juilliard composer that runs our Center for Performing Arts Medicine, is in Nashville right now talking to the Vanderbilt Medical Center about just that. And Todd went to, obviously he undergrad was at Eastman, and so he went there and talked about it. And then I'm a professor at Weill Cornell, so we started one there. And it just needs to have, we've already figured out how to round out the wheel. We just need to share that experience with other places. And we've got plenty of people that can come and help with that and show how to, and Todd is a genius at that. And he would be great in how to get the orthopedist and the neurologist and the neurosurgeon and the endocrinologist and the nutritionist and the internist, how to get them all working together for the good of the performing artists, because most doctors actually love the arts and go to the arts. And so it's a natural to find the ones that are most interested, whether academic or private practice, and get them involved and put them in a little cadre of folks that'll take care of performing artists. And
yes,
help you with reflux, because it's such a controversial subject. And if you ask 100 doctors, you'll get 100 treatments. And the Bob Saddlehoff's got a good paper out of Philadelphia, so you can go to Bob's work there in Philly and find out what he says. And I agree with everything that comes out of Bob's mouth. But it would be nice to have there is a position paper on reflux from the American Academy of Otolaryngology.
Yes, thank you, Vic and Ron. Yes, Ron, I think this is not an easy situation, but I do agree with you in both things. And well, I think Collegium Medicorum Theatri has to work. I know everybody is very busy, and with the pandemic and everything is terrible, but I do think the pamphlets are important, Ron. The pamphlets for the criterion, perhaps Dick and his group can help us, Dick, and give a structure that we can make some statement about how to build this team group, Dick, with your group. It would be great, because Ron is right. We need this communication, written communication. And the other thing, I also agree with you, Ron, communication to all this huge population of the speech language pathologists is important, because they belong to the group. So we need to make some criterion, very detailed, but not very heavy, about digestive problems, because it is not only reflux as we have seen today, it's all the digestive problems, and everybody has different recipes, everybody has different treatments, or many scientific papers are correctly done. But anyway, this is a huge problem, because you have many factors in the same pathology, and this is why it's not so easy. But I agree with you, we have to communicate. And now that I have been reading all the literature, also there are some cultural things. For example, Many persons say that the vegetarian food is the best in the world, and you go strictly to heaven if you have it. Or if vegana is a miracle and things like that. So we have to stay with science and art, because that is what Collegium Medicorum Theatri is, and that is what our patients and our population is. So we are human beings with neurovegetative system, with digestive and respiratory systems that are completely connected, but also with the development of the brain, we have more emotions and more brain, sometimes not so much, but okay. And so it's difficult about that. But to make statement, I agree with you completely. So please, dear audience, we have to work with ideas. What do you think, Peter, from Germany? Your micro, we don't hear you.
Can you hear me now?
Yes.
Hello, hello. So I had some problems with the connection, so I'm very late, but I heard some stuff, and I want to say thank you at first for your work, Eugenia. And one about this topic about connections and teamwork. I think it's very important to have these networks, and I think it's very good, but I would say that it's also dangerous for some opera houses when they say you have to go to this doctor, and only, or sometimes there are also contracts with the artists that they are only allowed to go to one doctor when they say it. So because there's also freedom for the patients to go where they want to. And I think the best PR is to be a good doctor. I think so. I think and to have a connection to the singers, not to the opera houses at first. I think I always say I'm the doctor for the singers, and I have good connections to the opera house. I think it's more important than to say I'm the doctor of the opera.
Yes, you are right, and this is important because I mean, sometimes I have had very huge problems because with the producers of a certain concert with international singers like Christina Aguilera or Juan Gabriel or whatever, or some opera singers also, Ramon Vargas, Javier Camarena, that I had to cancel. And of course, Joseph has also problems in Salzburg. And I am not working for the Mexican opera, but I do advise some things. For example, if they want, they can offer to the singers to be examined by me, because I am working in the artistic voice area. If they want to be examined before all the rehearsals and before the opening presentation, and they offer that as they can pay it. I mean, the opera house pays me, but they don't have to if they don't want to, because we know the relation between medical doctor and singer is very personal. But we can offer that, for example, and also I try also to support opera house. I explain to the opera house why it's important to have the international singers that cost a lot of money in Mexico, to have them properly examined, and of course, politely to offer some examination, because it has to be politely, no? So it is not a easy situation, but if an international singer knows about Collegium Medicorum Theatri, and for example, his or her doctor is Peter Hulin in München, and Peter Hulin knows me, what I am doing in Mexico, so Peter Hulin can recommend Eugenia in Mexico. And that was the main idea of the founding of Collegium. And for example, I have many patients from Bob Satalov or Joseph has some patience for me because they are singing in Salzburg Festival or things like that happen, no? But I think we have to keep on. Yes, Dick.
Peter's right. I mean, in 35 years of being the opera doctor, I was never paid a nickel by the opera. I pay the opera for my seats. I pay for everything, and I never charge an opera singer. I'm an advocate for the singer, not the opera house. And I made them very upset many times by calling them and saying, "This guy's got a hemorrhage on his vocal fold. He is going back to London." And I think we need that idea. Now, if everybody can't afford to treat people for free, and I took insurance from anybody that had insurance, but if they didn't have it, they didn't get a bill. And everybody thought it was the opera house that was paying me, and they never paid me a nickel. So I think your point was exactly right. And that is, our obligation is to the patient, not where they came from. And if we do what's right by the patient, then we're going to be able to sleep at night and be happy in our own, content in our own world.
Yes, it is.
That was always my motivation, was never what was good for the opera house. It was what was good for the patient.
Yes, and also to work in team as the concept of Performing Arts Center. I mean, it doesn't need to be physical center, but the concept can be, because I was developing that yesterday.
It is a figurative.
The connections.
I don't want people that are students to fall through the cracks. So I made all these doctors, 105 of them, agree that they would treat students for free.
Yes.
And that they would get them in within 24 hours, whether it's an ankle or a foot, a shoulder, a TMJ, a dental problem, that they would treat them. And that way we put them all on the list, and they got plenty of paying patients. So it compensated for the ones that they treated for free. But I think that is great, not to let the students fall through the cracks, and take care of them as well, even if they're not insured.
Thank you, Dick. Peter?
Yeah, this is very interesting, because I think there's some differences between the contracts with opera houses around the world. Once I had a very interesting experience with the Russian Queen of the Night, and she made an appointment with me. It was Sunday afternoon, and I went to the office, and because it's very close to the opera. And I waited there for 1 hour, and she didn't come. And then I called the opera. I tried to reach her by her Russian phone number, and it was not possible to reach her and to get a connection. And then I asked the opera, "Where's the Queen of the Night?" And they were very obsessed, and they said, "Okay, oh, there's a problem. Where is she?" And then she immediately arrived at the opera, and there was a mask room, and we did these things. And then she said, "I thought you are paid by the opera, and so it doesn't matter if I'm coming or not." So I had a waiting time for 2 hours, and so often I've seen no money at all. And so sometimes it's very interesting, because in Russia it's it's different. So in Moscow and St. Petersburg, so there is a doctor at the theater, and they waiting for the patients. If they are coming or not, they will be paid. And so maybe I can ask you, maybe Eugenia, a very close question, familiar question. You have a contract with the opera?
Yes, I have contact to the opera, to all the directors of the opera, but I am not paid by the opera. I was never paid by the opera. For example, I make a research in the opera, and I didn't charge for that.
Okay.
How can we improve the environment of the stage, of the dressing rooms, and in general of the opera, in order not to have so much dust, so much changes in temperature and things like that? I make this research with one of the directors, and usually I go to the opera, I talk to them, and of course I invite them to my conferences and concerts, but I am not paid by the opera. But if somebody is sick from the opera, for example, an international singer comes, they send it to me, because they know I am working with artistic voice, And of course, because they know what Dick says, and you also said, Peter, that I try to be as ethic as possible. And I try to help everybody. I try to help first the singer and then the opera production. And then I speak with the opera director if I have to cancel. And I say, please, it is not possible because of this and this and this and this and this. I am very sorry, but I have to take care of this singer. And also happened, for example, once I was in El Trovatore with Ramon Vargas, and I was with him vocalizing in the intermission, and he was perfect. And in the second part of Il Trovatore, suddenly they announced he had an allergical reaction. And I was there listening in the audience, so I went to the dressing room, and Ramon was without any low tones, without any high tones, without any voice. What happened? He ate a turkey sandwich and he had an allergic reaction. And so one of the choir singers, also tenor, had already experience with this part, so he went immediately and he started to singing. And I want to ask Reynaldo before I ask Joseph. Reynaldo, which is your experience with opera houses and things? Reynaldo, are you there? Or you left?
Yes, I am.
Okay.
Hi, everybody. Thank you for the question. I completely agree with everyone that we have to help the performers and the singers and reduce our direct contact with the directors and with the productions, because the productions they want to save the show because of money, and sometimes they would like to force the singer to go to on stage even without excellent and perfect voices. And we know that the main cause of lesion, vocal lesion in performers, professional performers, is the attempt to save the show and to honor the commitment to perform that night. And I had one situation in which the production paid for another laryngologist, another performing arts medicine doctor, because they knew that I would cancel the participation of a musical theater performer that night, once there was almost no voice in that person who was performing Dinala in the Lion King show 8 years ago. So I really reinforce and stimulate the doctors on the audience to be beside the performer. And of course, we have to use our political party to know how to deal in between the producers and the performers. And you have to think about the impact of saving the show by the producer's point of view. If the other performers know that we are saving the show because of money, they will tell everyone that we are not saving their healthy, their vocal health. So better to be beside our patient always, as we are doctors.
Yes, yes, Joseph.
I agree totally with Richard. The opera houses should pay the money for the singers because they pay the money for all the stuff. They pay for the costumes. They pay for the stage. They pay everything for the other materials. They should be within all the project of an opera, the health of the singers. In my situation, if I have a good situation, I do not need money from the singers because I'm paid from the house. I'm paid from the house from the time I'm here. So it is equal if some workers comes to me or a singer comes to me. singing voice for me is a working horse, like the knee of an other worker, and that we should work in that direction to open the mind of the opera houses of the world, that they had some money for the health for all the persons in the house, the singers and the others.
Yes, you are right. Your situation is different, and because you are also an occupational doctor, it's easier for you, and because you are working with the opera house. So this is interesting that we are exchanging this experience. Tom Harris, would you like to add something, because you have been working in London many times with also in this situation that we are discussing? Do you want to add something, dear Tom?
Yeah, it's always a question of how to deal with an acute problem. I just want to know from the erudite collection here, how many people manage to run a multidisciplinary initial consultation? Yeah, because it's not possible for me to know everything about everything. I rely on the knowledge of colleagues and things, and we used to run a 400 voice clinic for initial consultation, diagnosis, where to go, what to investigate, and formulate in front of the patient why we thought they should go this way. And it just made life very much faster. But it was possible in London. I was just wondering, is it possible elsewhere to run truly multidisciplinary clinics, i.e. with the bodies actually lined up to sort of look over the patient's shoulder or whatever, you know? Makes for very crowded rooms, but it worked very well.
How does it work, Dick? Yes, Tom, sorry.
We do physicals on the ballet every year, and they get everything. They get to see an internist, a psychiatrist, a nutritionist, an orthopedist. They go through the whole gamut once a year. And for the opera, I try to get all the members of we don't have a repertory opera theater. We import great talent from all over. A few live in Houston, but most of them are actually European. And so that's our group of young singers that are in the Houston Opera Studio. We bring them to the office every year and I do a video stroboscopy on every one of them. And I give them a DVD of that video stroboscopy and a picture. And the reason I do that, and I've done it for 20 years or 30 years, is because I got a tearful phone call about 15 or 20 years ago from a soprano in San Francisco. And this is before my buddy Clark Rosen moved out there. And now they've got great laryngology, but she was crying because she'd been to the opera doctor in San Francisco, and he told her that she had nodules and that she really wasn't a soprano, she was a mezzo. And so it made me furious, and that's why I started giving everybody a picture, because Jim Gould himself said that about 80 sopranos he'd seen with the Metropolitan Opera had what one might call nodules, but I never use that term. I said a slight swelling or singer's calluses, or use any word but not nodules. That's like telling somebody they've got cancer. So I think if you do that, then you give the patient, you empower them with the ability to say, well, does it look like that? Yeah, it looks like that. Well, that's what I had in Houston. I was singing fine. Okay, well then maybe you just got a cold. And so it's a problem. And Friedrich Brodnitz in New York, do y'all remember Friedrich Brodnitz? Anybody remember him? He was a laryngologist from Germany. It was in at the Voice Foundation in New York. And for 20 years, I gave a talk on how to do video stroboscopy at the American Academy of Otolaryngology. It was a 2-hour talk every year. And then I talked once at the Voice Foundation about it. when Friedrich was alive, and he said, after I finished this, what I thought was an incredibly erudite talk, he said, well, Dr. Satsney, let me remind you that all that technology is great, but you need to remember the milk of human kindness, and that you're not taking care of machines, you're taking care of human beings. And it's, you can't just put people in a machine, send them out the other end with a bag of pills and think they're going to get well. You've got to understand psychology, how you deal with performing artists. I mean, it's a complicated thing. And Friedrich brought me down to ground zero. That was 30 years ago in Manhattan. And I've tried to remember that ever since, and remember that, yeah, I've got all this great technology and I can't take it to the opera house. So if they're sick, they really pretty much have to come to me. But it would be nice to remember that they are human beings and need to be treated like that. And Tom, I'm sorry we're not in Lyon eating at Paul Bocuse again.
Yes. Okay, thank you. I'm sorry I have to change subject because I want to ask Eleonora before she leaves. She is dealing, as we saw in her video, with a very interesting, how do we say, different aspects what a singing voice can do. And I would like to ask you, Eleonora, which is your experience, not only that you have made this research with our dear Franco and our dear Erika about these special sounds, but which is your concept about these sounds for rock and jazz and other aspects and styles of singing, Eleonora?
You mean about the necessity to help the artist in this particular period?
Yes, yes.
Sorry,
yes.
because I had a problem with Wi-Fi, so there is a part I didn't see. It's a very difficult period for us, and especially for pop and rock artists, because in this period is really difficult to have a concert, and it's difficult to have to have the people in rock and in pop concerts. Usually the people is free, stand, are together, so it's very difficult. In this summer I was in tour with an Italian artist, and it was really difficult to help her. There was a lot of problem, also psychological problem, a lot of stress. Everything was really difficult, more difficult than what we are used to manage. And so I think in this period in particular, also pop and rock singer need to be helped by a vocal coach, teacher that help to have a good technical work, to have a good voice, to be in a balanced situation, but also they need to understand when we need a doctor, a phoniatrician. In this summer, 3 times I had a very difficult situation. The artist was without a voice at all. He was very tired, very nervous. Every day there was we didn't know, okay, there is the concert tonight, we don't know, maybe, but also maybe not, if just one of the crew is positive to the COVID. So it was a really, really very difficult. And we had sometime the help of the phoniatrician, in particular Fussi, but there is I think it's really a difficult period, and we have to help artists.
But in for example, I can understand. And what about the aspects that we were discussing? What about, are you working with the singer, or are you working with the company or the production company of this concert? Because it's interesting.
Yes, this is very, very, very important question, because sometimes if we want to help the artist, we have to say, okay, stay, rest, tonight rest, but the company and the manager and the label and the major, so it's very difficult to manage all these aspects. In pop and in rock, sometimes I think it is possible to have a concert even if the voice is not perfect because of the style. And this is something that may seem useful for the artist, but not always is useful for the artist, because sometimes the singer sing again and sing again and sing again, and at the end the situation become very, very hard, and it's very difficult to find good and balanced voices. So it is really, really very, very difficult. I try to explain the importance of a safe voice to the manager, to the label, to the management.
Not an easy situation. And Tom, what about you in this kind of, for example, not only classical singers, but in popular singers with rock and things? Because I also have some experience, such as I imagine Dick also with the rock singers. Were you, Tom, seeing them in the concerts live, or only in your consultation or at the university, Tom?
Well, yes, I saw rock and rollers and things. The most durable voice I ever came across was a guy who sang heavy metal 3 hours a day in practice, then a 3-hour performance at night, 8 days in a row, change country, fly to somewhere quite else. They do this 4 months a year. And his idea of a good note was an A5, yeah, which he liked to take in full belto mode. He developed some problems, and everyone had sort of said, oh, it's a system, it's your abuse. But actually what they'd failed to notice was that while he was doing an A5, actually had a very small ventricular cyst which came out. And so it wasn't his level of work, it was actually just a very small cyst that nobody had bothered to say, what is your problem? It's a note? And so we asked him and did it, and it took, several seconds of surgery to put him right. And he gave me a sort of lifelong sort of behind stage, tickets for wherever. You will have seen him, it was really quite big time. But, yeah, we did them. And we like to think of, sort of heavy metal singers as vocally abusive, but some of them are performing under gobsmackingly awful conditions and get away with it.
Yes.
He was a considerable vocal athlete, it must be said. And I was surprised at how little damage over the years he did himself. He's just one. I know of nobody quite that successful in the long distance.
Well, he was really surprising Superman. And Dick, do you have some experience with rock singers and heavy metals or jazz or all the Nashville singers or the country singers that are from little town to little town?
We were just there for the highest bidder. We saw everyone in the voice clinic. Yeah, we saw a lot of patients from the garden and, you know, all stations in between, students, those that could pay.
Tom, you still have that osteopath working with you that manipulated the larynx?
Yeah, it was actually Sarah, my wife's fault. Was the voice therapist. She said way back when we were working in Oxford about 35 years ago, I really want to know what physical therapy would do. Aronson wrote a paragraph about it once, a million light years ago, and that was the extent about circumlaryngeal, you know, let's do something. But we sort of were looking for physiotherapists or anything, and we happened on Jacob Lieberman, who said, I can fix that. And we said, well, what's your experience? And he said, I haven't any, but we can fix eustachian tubal dysfunction and stuff. And we said, right. And we spent 3 years looking at posture and everything else. And we evolved the Lieberman protocol and that, blah, blah, blah. And it's now sort of standard to approach it physically as well as psychologically. But it's not commonplace and informed around the world, you know, manual therapy. It's a pity.
Yes. Eleonora, you are working with Valentina Carlila. Which is your experience in this kind of artists with manipulation? I know she's a professional and she belongs also to Collegium. Unfortunately, she couldn't come today. But which is your personal experience? Because you are dealing with pedagogic, with singing, and how can Valentina help you?
Oh, Valentina is a great help for the artist because she can help to find a good situation on the body, and she can give to the artist the body situation to have a good voice work with me. And it's very interesting to work together with the artist. In the last period, we worked especially on the hyoid bone. Is really very, very important how the artist can be free in all the body to find balance, but especially in the neck, in the larynx, and to have a good situation with the body is the most important thing to work with the voice then. So I think it's really, really very important to join the work, to be together.
Well, again, teamwork. And I want also to talk a little bit about, unfortunately, I think Alfonso left, but I think this presentation of Alfonso and Joseph, and well, my humble presentation, I think that shows us the importance of having all together, because as we see from other medical doctors, I don't know your experience with this situation, some other medical doctors, they do not examine everything, so they go directly to surgery, or some of the SLP, they go directly to voice therapy and they forget about the other things. As Dick says, the experience that Gould told you, human beings, is important because the human being is very complicated. We are wonderful, we are delightful, and we have many, many factors that can affect. And this reflux thing with allergies and environment is really complicated. I am sorry that Alfonso left, but I found his presentation wonderful because he's pointing and he's showing us all the details from all these the parts, for example, the adenoids, because usually the adults, they do not have adenoids. So in my daily experience for many, many years working with allergies, I do see that there are many problems that sometimes are not examined. And for example, Dick, in your teamwork, hello, in your teamwork, Dick, you are dealing also with the changes of temperature, environment, and things like that.
Yeah.
Yes, Dick.
Let me interrupt and introduce Todd Frazier, who's the composer in residence at Houston Methodist Hospital.
I know Todd. I know you from Houston. Hello, Todd.
J. Todd Frazier. Unmute yourself, Todd, and introduce yourself.
Well, thank you. Thank you for letting me listen on. It's been really interesting. I love this group. I loved meeting some of y'all when you were in Houston. I look forward to being in person next time. And we're just continuing with all the work that we presented on while you were in Houston, though we've expanded greatly in our artist health program across the region and nation, as well as some of the other ways the arts contribute to health with creative arts therapy and different arts integration programs, as well as research. So I look forward to catching up with everybody at another time. And thank you, Dr. Satsney, for sharing your Zoom link with me.
I'd like you particularly to
Thank
visit
you,
with
Todd.
Dr. Shearer there, right next to you, because he's asking about Centers for Performing Arts Medicine and how you get them going. Nobody knows like this man.
So we have to go again to Houston. But Todd, I would love, as president, to have something written from you. I have already been there, and well, of course, I agree with this concept, but it would be great to have something written also, and perhaps we can join in another informal Zoom meeting, Dick, and who everybody wants, I can invite who are interested, and then you can give us a very detailed situation, Dick and Todd. Okay?
That would be fun. Good, because we have helped 3 or 4 centers get up and running recently, that most notably the one at the Eastman School of Music with the University of Rochester. So there does tend to be, if there were certain resources within your community, hospital, arts conservatory, proximity, that there do seem to be some benefits, and we can talk about that next time, or I could contribute just a little white paper to your group just as an update of what's going on.
Yes, but also I want to say dates, because it's important that we put it in platform. For example, if you are so kind to send us to my mail all the information, and then perhaps in 1 month, Andrea, Tom, Reynaldo, of course, Dick, and I can send the invitation to an informal Zoom meeting. Then you can explain us, and everybody can think what to do. Because, for example, Andrea in Cesena, he's also working with a group, and he has experience working with Alfonso and with other things. So I would love to have this Zoom meeting, Todd, with you and everybody. Yes, Ron.
It would be interesting for you guys, Todd and Dick, to put together criteria for different levels of a medicine or arts health program, because different groups have different resources. So what are the criteria and the thresholds for different levels of care for perhaps a smaller than larger and larger group of people to help, from students to professionals, depending on the certain aspects of resources in the different cities. So something that would fit in a hierarchical way, fit different regions well. And then instead of going for the full blown or for the least, have these options, and especially the criteria. One of the comments that I would have made earlier was what Dick was saying. When we tried this sort of thing in Denver and other places, we did not have interest because people were not going to make money. And it's that voluntarism of skill and that is really quite important. And frankly, I think that it's that voluntarism, so to speak, of the expertise is an investment, because later those people are going to come back to the performing arts health professionals with them and their students and other people. They will remember. So in the long term, it could be very profitable, as you might have discovered in Nashville. So a hierarchical ordering of different levels of arts medicine in different kinds of venues, that'd be really helpful.
Yes, and I think I agree with you that that we have to do that. And Eleonora, what is your thinking about this concept? Because you have just working in many areas, and how is about you in this concept of teamwork and performing arts center? Because it can be, I imagine, because of the
I think it's really a good thing. Yes. Yeah.
Yes, so Todd and Dick, perhaps we can have this information, and I can send the information to all the CoMeT members and arrange a meeting. And as Ron proposes, I love that that proposal, Ron, different levels, so we can say something. I don't know, Andrea, if you want to say something about this concept, because you have also experience in groups.
Can you hear me, Eugenia?
Yes, perfect.
Yeah. Many compliments for how you presented the presentation of Joseph. Many compliments, really. Really. It's a basic thing to work together, to have a good team for the patient, especially. So I agree with you, with Eugenia, and the new young phoniatrician Marco Fantini that is in our group can bring us the wind. Yes. And so it's important to share the experiences that the old phoniatrician can share with the young phoniatrician, and so on.
I am happy because Italy is very important, and now that we are, even though we are a small group anyway, we are important group. No wrong?
Yes.
So I shall make that with your information, Todd, and I thank you very much that you join us. And well, before we end, we want to speak a little bit, please, about reflux. The experience with changing, of course, Eleonora has to leave, but if she can stay, it would be great. Anyway, we shall talk about food, dear Eleonora, because food is for everybody important. But
it's really important, especially in Christmas time.
Okay, and Dick, what about your experience with all these long time treatments? Talking about the presentation from Alfonso, that I am sorry he left, but the discussion is until we are dying of boring. Yes, Dick, tell me, please.
John Rubin, about 10 years ago, I got nervous about
Don't leave, Todd. Sorry, Dick, don't leave, Todd.
I got nervous about the long-term effects of PPIs, and so I'd be interested in see what Tom Harris says. I used to send patients. I've heard about Gaviscon Advance in United Kingdom, and I used to send patients to London to pick up a stash of Gaviscon Advance because you couldn't get it in this country. And then a patient came to me about 10 years ago and said, Amazon will deliver it to you. And so you can get it anywhere in the world from Amazon. And even though it's not FDA approved in our country, probably because it's got saccharin in it as a sweetener, and FDA doesn't like saccharin, because mice could get bladder cancer from it if they ate 20 pounds a day. But anyway, I've started recommending that to patients if they've got terrible reflux, and every time they eat, and then at bedtime, and it's been dramatic. And I used to have heartburn and did a couple pH probes and found out exactly when I reflux. And so I take Gaviscon at night, the Gaviscon Advanced from the United Kingdom, and I haven't had heartburn since. It's been 10 years now. But Tom, are you using Gaviscon Advanced?
Well, I've now retired, but right up to the very last, yes. And certainly I use it for me. It's basically because it's a physical medicine rather than a chemical medicine. And you've got this island of alginate sitting on top. So it just forms a cork.
Yeah.
Assuming you have any sort of cardiac sphincter at all.
That's why I love it, because it doesn't.
Yeah, it's okay.
So I've
and Andrea, do you have some experience? Yes, Ron, one moment. Andrea, with this Gaviscon, because I have some experience also with Esox, that is from Italy. Esox 1, that is hyaluronic acid. But which is your experience with the patients or with yourself about these substances?
Yes, I agree with you. It's crucial because I would like to point out also the problem of the pepsin in the pharyngolaryngeal reflux. And the hyaluronic acid can create protection against the damage of the pepsin in the larynx. Because the laryngopharyngeal reflux is influenced especially by the pepsin, not only by the acid of the reflux.
Yes, yes, yes.
Yes,
yes. Ron is now. Ron.
Well, I have two questions. One, doesn't the Gaviscon also tighten up the lower esophageal sphincter? And secondly, what's wrong with the local store Gaviscon? Does it still work, or is it just like 50% less effective or something?
Yes, Dick.
No, there's something magic about the English Gaviscon. It's a different chemical, and it does exactly what Tom said. It forms a cork on top of the stomach contents and keeps things from going up. And I think that's much more physiologic. And we did 2 pH probes with impedance on a lot of people because non-acid reflux can be just as bad as acid reflux. And so the nice thing about Gaviscon Advanced, it seems to stop both. And Jamie Kaufman, actually, you'll appreciate this, was sensitizing a goat to pepsin. And then he was going to have you could just swab the mouth and see if there was pepsin in there. And you knew that they had bad reflux. And his goat died, so he didn't get to finish that study. But anyway, I think the Gaviscon Advanced seems to me to be the safest and simplest thing, and it's cheap. It's like $10 for a bottle of 60 of them.
Yes, yes, Reynaldo. Do you? Sorry, Ron. You are sorry, Ron.
Well, what about at your local pharmacy here in the United States?
Not FDA approved in the U.S., so you can't get English Gaviscon in the U.S.
Right. So what about the Gaviscon we can get at your local pharmacies here in the United States?
For some reason, it doesn't seem to have the same effect. I'm not sure. Tom might be able to talk about the chemicals more than I can, but it seems not to be as effective as the English version.
We don't have in Mexico Gaviscon Advanced, but we do have Esox, and I have been changing because sometimes it really doesn't have a good function. But talking to the GE, to the gastroenterologist, they have a trend to use more Esox, to use more acid hyaluronic with another things. For example, with prokinetics, that this is the other problem, because in the States there are not so many prokinetics. I don't know if you have domperidone. This is a very old prokinetic, Dick and Tom.
It was
domperidone.
denied by the FDA here. So I send patients to Mexico if they've got esophageal motility problems to get that drug, but it's
Okay.
not available in this country.
Okay, wonderful. And Andrea, do you have some experience with prokinetics in your patients? Micro, we don't hear you.
Can you hear me?
Yes.
We don't use very frequently the procinetic, but the esophageal motility is crucial. I agree with the colleague.
Yes, 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 and also what I point is the situation, the how do you say in English? I'm sorry. Well, the complicated situation. What Alfonso said about the lymphoid tissue, because the lymphoid tissue give you many details, and exactly in the artistic voice. Dick and Tom and Ray, I don't know your experience, Ron. There are many persons who have very low allergy. That means this is a very low level of allergy, for example, to some trees and to dust. And dust, this is universal. We have all over the places. And of course, if you have this reflux in a very sensitive mucosa with lymphoid tissue, then you have more problems. I don't know if I made me clear with my English because I was thinking in German. But the thing is that if you have a sensitive mucosa reaction due to reflux, and then the tissue is a very low level allergic reaction, has a very low level reactive allergy reaction, well, it is complicated sometimes. That's why sometimes, Dick, in the international singers, I use both things. When I look at the nose and I look at the pharynx or at the nasopharynx and I find some lympho tissue, I made a little bit of desloratadine with reflux treatment. I don't know, what do you think here? Yes, Tom.
Does anyone still use gravity?
Which one?
You tilt up the head of the bed and
oh yes, of course.
Well, I think a lot of people forget to mention anything like gravity.
No, I mentioned that.
It stops all that acid swilling around in your esophagus while you're lying flat.
She had B on her slide, HOB.
Yes, Dick, I would like to your experience, if you had this situation that Alfonso mentioned. What do you think about that?
You know, I'm not exactly certain what situation you're talking about.
Yes, the situation is if you are an allergic patient,
yeah,
but a very low level allergy, that means some tiny problems of allergy in the nose, in the nasopharynx, in the pharynx, and in the larynx, and you have reflux, then you have more problems. And if you are traveling from one continent to another to sing, and you are changing your food, for example, when I go to the States, I have to be very careful where I eat pommes frites or some fat thing, because sometimes the fat is different than the fat in Mexico.
Yeah, no, you're right. And there are cofactors for everything. It just, I like things I can measure and know precisely what it is. And that's why I'm a big fan of the 2-channel pH probe with impedance, to say, do you reflux? What causes reflux? And when do you reflux? And is it acid reflux or it is non-acid reflux? So I feel strongly about that. Allergies, you know, I've never been, other than nasal steroids, I really don't get too involved with allergies other than send them to an allergist. I think it's important to consider all options, and cofactors are cofactors.
Yes, and also that's why I made this fellowship in allergy in ENT, because I was dealing with problems that I could not solve properly And sometimes the allergologists, because they think about very, very high level of allergy, respiratory allergy or food allergy, and not the tiny ones. And the artist, everything is very tiny and detailed. I don't know, Andrea, because my patients have been measured, Dick. I have measured these patients in blood, IgE, with every allergen in food. Yes, Andrea.
Oh, do you perform also nasal cytology?
Yes, yes.
Yes. Okay.
Yes. Yes.
Because in our department we are since 3 years expert in this type of test, cytology, nasal cytology.
Oh, this is good. Well, I don't know if somebody wants to say something about all the interesting concepts that we had today. Ron? I am so glad to see you here, Ron.
Well, it's always great to be seen and to see everybody else. And it was nice to have the new members. They seem to be very talented and dedicated and working with good teams. So that was great. This session kind of raised one of the questions of what sort of products or outcomes or videos, etc., that we want to archive relative to CoMeT. So do we want to move in the direction of being able to offer things like that to our CoMeT members and other groups outside? So that's one concept as an organization that kind of came up here this time. I wanted to tell Dick that I still use his cases in my voice disorders course, the video cases. They're always so great. And I wanted to ask Dick, last time, well, maybe not last time, you made the funniest statement I've ever heard about retirement. And I'd like to ask you if you can remember that. Instead of retiring, you're forgotten somehow. What was that statement? Can you
please tell us?
I'm too old to remember now, Ron. Sorry.
Oh man, well, I'll have to tell you then. So, because I'll have to remember it. It's the funniest line. I want to remember it if I ever.
But what did he say, Ron? I am curious.
All right, I'm going to look it up. Maybe I wrote it down. I don't know. It was the funniest thing.
Well, I think and I agree with you all that our group is important because we are an international group and we are experts in artistic voice, and also because we have been working passionately about solving problems in the artistic voice. So what you are doing, Todd, Dick, and your groups is very important for us. So this is an organization situation, and I agree that sometimes, well, it is not profitable, but it is not life. Money is not life. Money helps to live in something situations, but it's not life. But I think as an academical group of experts, we are obliged to make these statements and try to change the organization, Ron. Okay,
Well,
I agree with you.
Eugenia, the name of the organization is CoMeT, which doesn't really say anything about voice. It says more about theater and performing arts. And so I think it's a natural to get people like Todd involved who can talk about bringing a collection of disparate doctors that have different expertise together so you can take care of the whole performing artist.
Yes, yes, I agree completely. And well, I remember when Todd presented the presentation and presented a PowerPoint presentation in Houston. So Todd, if you are so kind and make this presentation, and we shall have a Zoom meeting. And of course, our Zoom meetings in CoMeT are a little bit long because as Collegium, we like to discuss things. That's why I thank you very much, Todd. So you are now invited to work with us. Yes, Dick? And Ray, Tom, Andrea, Ron, something else? Well, don't forget next time. Next time is hearing. And I don't know why Alfonso left, because I wanted to ask him many things. But anyway.
Alfonso had problems with the connection, serious problems with the
connection. Dear. Okay.
This is a problem. This is a problem.
Okay. Anyway, as Eleonora said, we need more and more sessions, but of course we have to work also. So the next informal session is with Todd and Dick, but please first the information. And well, I thank you very much for your quick visit, Todd. It was great to see you again. I hope I can go to Houston soon if Corona allows that. And I hope we can see each other also in Tel Aviv. So Todd, you are part of us, you have to come. And Reynaldo, thank you very much for staying. Dear Ron, I love you always. Thank you. And our dear Tom, and Sarah left, Tom. It is not fair. I know the medical terminology is sometimes boring, but we have to discuss about these things. Dick, thank you very much.
Thanks.
I love you dearly, and I enjoy very much your proposal, and I think this enrichment from you is going to give many persons another universe. And Andrea, Carissimo Andrea, thank you very much for staying with us, and I thank you all.
My pleasure.
Bye-bye.
Thank you.
Ciao, ciao.
Bye. I wait for you, your information, Todd.